So I'm going to show an example of you doing a total knee arthroplasty with the SurgiSTUD knee model. First thing, skin incision is actually very realistic. I'm coming through that, and what you'll notice, there's another whole layer. Well, everyone has some level of subcutaneous fat, and that's realistic in this too. The model here shows the quad tendon. It even shows the VMO muscle belly, which helps determine where you make, in this case, is going to be a medial parapatellar approach. But the cut of the retinaculum feels very realistic, and that tissue is real in there, and this is a key part to a normal exposure. This really replicates that exposure quite well. And here, doing a medial release for exposure, again, in reality, this wouldn't just open up. You have to do this step. And this model really allows you to work on the exposure and realize it's an important part of the case. In this case, we're going to go to the patella resurfacing next. And I think the one thing that I can't emphasize enough is the density of this patella is such that it feels real. And to make a bone cut like this and have it feel real is very unique. Sawbones just don't allow you to have this, and even cadavers often don't give the correct density. So I've made that cut. Drilling for the lug holes, again, can often feel very abnormal in both cadavers and in sawbones, but in this SurgiSTUD model with the density specifically placed, it's very nice. I do a lateral facetectomy, just demonstrate the feel here is very good, and when I did that facetectomy, it did detether the lateral retinaculum a bit, which would be a normal anatomic finding in a case. So again, very realistic feel to that step. So again, as opposed to, say, a sawbone, so soft tissues are in the way, and that's important to realize. That's a normal part of your operation. Retractors are used, and again, in this case, it's conventional total knee arthroplasty, so an intramedullary rod is placed. Just as appropriate, this could be done with a navigated or robotic procedure as well, with, again, the consistency and field anatomy being very similar to a normal operative patient. The pins placed, for instance, in this guide feel very normal. They're not too hard, they're not too loose. They really give that feel, and it is very stable in there, as opposed to, say, a cadaver model that's very weak bone might move with the cutting guide, and even a sawbone where you don't have any stability. This gives a real feel, and again, I can't emphasize how nice the density of the bone, which can be adjusted in different circumstances, but in the standard model is set for fairly standard bone density, and the cuts feel normal. There are soft tissues that are left in the model, and again, this can be adjusted and modified as well if needed, but just like you would in a normal procedure, you do address these. And again, with the different jigs, putting in the pins, again, it feels normal. It feels normal. The sizing of the models can be adjusted, but the standard model has an average sized anatomic model from anterior, posterior, medial, lateral dimension from the bones. But again, sizes and patient habitus can all be adjusted if needed. But the standard model has a fairly standard size. This is very helpful in that if you have certain products that might have different trays and such, you could count on using just the middle level sizes if you're doing a training on that procedure. And again, the feel of this, the cuts, all feel very normal, and again, the sizes are all anatomic. Here in this actual model is one that was set with an arthritic deformity, so it's perfect for this procedure, and that can be set up for whatever procedure is being done. The sizes, the cuts, everything that we use with this system is feels very much real, which again is not really ever the case with the sawbones, and is often not the case with cadaver specimen. Again, the soft tissues feel realistic. They are in the way like they're supposed to, and we have to remove them. So again, a fairly realistic feel to this operation. Again, some of these parts are often very challenging to reproduce in a practice setting. With the consistency of this bone, it's not difficult at all because it really matches normal density. There is no modifications procedure needed because of the quality or consistency of the model. So that's a very nice touch. If you see when we put that tibial portion in, it kind of snapped in. I mean, the tension felt like a real knee. You rarely get that with cadavers, you obviously never do with sawbones, but I mean, this feels like a real knee replacement. The stability, the tracking, the motion is amazing how realistic this can feel, again, with no disadvantages that the cadavers would add.